Thank you. Check, check. All right. Welcome, everybody. I'll now call the April 8th Public Safety and Community Health Committee to order. Thank you all so much for being here. Can I get a motion to approve the March minutes?
So moved.
We are actually not approving minutes at committee meetings anymore.
Oh,
There's no minutes in the packet.
okay, great. Well, thank you so much. And just kind of one change to today's agenda. We had the monthly report update listed for Chief Lundgren and Chief Oberg. We would usually move that over to the beginning of our discussion items, but without further ado, I'll bring up Chief Lundgren for our SPD monthly update.
Good morning, Council President, Council members. I've got Lieutenant Booth and Lieutenant Spearing here with me as well. It looks like we're going to update you on your requested items as well as the Chief's update all in one compact little section. So if I'm bumping up against time, please let me know.
And Chief, you can use the clicker, the down arrow to advance slides.
Oh, perfect. Is there any way to get that window there? Thank you. So looking at our calls for service 2022 through 2024, our numbers have slightly come down from the first quarter of last year, but we're still quite a bit higher than we were in 2022. Arrests are continuing to increase throughout the year, January, February, March. I wanted to just bring this to you every public safety meeting so you can kind of see what we're looking at. The number of arrests for the first quarter of this year are higher than the last 2 years, and you can see that the number of arrests in February and March were pretty much identical this year. Officers are continuing to be really busy. This slide definitely represents what we're seeing in the community, which is a lot more unlawful camping complaints that are coming in that we're fielding and responding to this year compared to historically. Officers are making it to over 90% of those complaints and making sure to get those people, at the very least, get them moved along and helping to clean up and not let people get established where they're at. Impounds. So I know the council was instrumental, I think it was 2 years ago now, in getting us support in having impound officers that are assigned to SPD. They've been very responsive to the community, and as you can see, each month they're going out there and doing their job, and it is so critical to get these cars moved along in a timely manner because problems start to happen in neighborhoods and in areas where these cars are allowed to collect. And they're doing a fantastic job. Two civilians that are going and doing the bulk of this work. And then our behavioral health unit, again, this is February's statistics. We're always a month behind, but many of the same kind of numbers that we saw last month. I'll draw your attention to, again, we had another month with 0% of force being used beyond handcuffing, which is just tremendous in these really high critical crisis type of scenarios. The partnership between the officer and the clinician is really a good combination to reduce force and to resolve the situations. And then again, we were able to divert over 70% of the contacts. They had an outcome other than going to our emergency department or to jail. Staffing. We had a request to include a staffing update. So we are currently at 344 of our 352 current budgeted commission staff. I believe we're down about 15 civilian positions as well. There's 31 officers that are in training or some other capacity that they're not being counted towards staffing at this point. We have 18 in training and 13 that are unavailable. As you can see, we're continuing to get good applicants, but the numbers just aren't as much as we have in the past. Right now, we have 11 entry-level applicants as well as 4 laterals. That consists of our entire entry-level and lateral list. 15 candidates right now that we have available to hire if they were able to pass through the process. So we're not getting the numbers we once did. And then I know that you wanted to hear Safe Streets. It's now Raven is the name of the team. I've got Lieutenant Booth here that's going to provide a short update on that unit for us.
Council, pardon me. So Raven, the mission statement that they developed as a task force is to provide a coordinated and concentrated effort to identify, disrupt, and dismantle existing and emerging violent gangs and mid to upper level drug trafficking organizations operating in the Spokane County area, thereby reducing the availability, use, and trafficking of illegal drugs, guns, and their profits of their criminal enterprise. Raven will maintain, equip, train, and operate efficient investigative intelligence and proactive suppression components capable of immediate response to the most serious criminal acts. The current structure of the task force is there's one Spokane County Sheriff's Office lieutenant, one technical assistant, an SCSO sergeant, one SCSO detective, and one SCSO deputy. We have one SPD sergeant, 3 SPD detectives, and 1 SPD officer assigned to the unit. There are also members from the Department of Corrections and the Border Patrol. The units report to and are directed by a board of directors. The board consists of members from the Spokane County Prosecutor's Office, the Spokane County Sheriff's Office, the Spokane Valley Police Department, as well as the Spokane Police Department. The Human Trafficking Task Force, which consists of an SPD detective, an SCSO detective, and an FBI agent, still remains part of an FBI task force, although they share the same space with the unit. Criminal investigations into both individuals and organizations that they're dealing with are quite complex and take a significant amount of time and resources, as victims and witnesses in these types of crimes that they're investigating are generally not that forthcoming in providing information. Since January 1st, they've executed 37 search warrants, seized 10 firearms, 3 vehicles, and approximately $40,000 are all used in the furtherance of criminal activity. They've conducted 7 felony arrests for drugs, robbery, assault, and burglary. They've had 3 DOC arrests and assisted with the Human Trafficking Task Force with 3 arrests for prostitution, sex trafficking of a juvenile, and 6 for promoting prostitution. One of the larger events they had is an investigation led to the seizure of 2 commercial-grade pill mills for the production of illicit fentanyl. According to the AUSA's office, this was the first commercial pill mill located in Washington State, and we've been looking, and I don't think we've seen one in Idaho or Montana as well. You'll see with the larger one, that is capable of producing 17,000 pills per hour, and the smaller one is capable of 2,000 to 3,000 pills per hour. After that seizure and subsequent arrests within the cities of Spokane, we actually saw the price of fentanyl go up as a result of the seizure, just because it truly impacted the amount of fentanyl in our community. They also conduct a significant amount of outreach. Our intelligence officer, as well as the deputy, focus a significant amount of their effort on outreach. They are responsible for gang prevention, intervention, and suppression. They participate in outreach to the prevention and intervention pieces and attempt to keep the youth out of gangs. Recently, Gang Intelligence Officer Valdez and Deputy Zickler represented a gang and youth violence training at the Next Generation Zone, or ESD 101, and the Yashuhara Middle School. Since that training, the schools have reached out for additional help and identification of gang members and things that would lead be identifiers that the teachers can assist with. Members of the Spokane Police Department are founding members and on the board of the Safe Communities Partnership. The goal is for youth gang members to get out of the gang lifestyle and to prevent future generations from joining gangs with an active intervention piece. They also help those to change family and friends around them, and also assist older gang members to get jobs and training to get out of that lifestyle. Are there any questions about Raven? Yes, ma'am.
So just for clarity, so the gang task force and the drug task force has all been rolled into this new entity?
They're the same exact entity. When they were the Safe Streets Task Force, they're still doing narcotics investigations as well as gang investigations. There was just a separation from the FBI, and Safe Streets Task Force is a FBI term, and so that hence a name change. Sir.
The pill presses you were talking about, how challenging are those to come by, or can they get them fairly easily?
Well, again, we're not
Yeah.
seeing them
Oh.
anywhere else, so it's very challenging. However, there are federal laws about the importation of some of the parts necessary to produce those. But while they're there executing the search warrant, UPS was showing up with additional parts and pieces for it while the officers were on scene. And so I want to say it's we've stopped it at the borders and it's not able to come in, but obviously that's not true.
Yeah, not true at all.
Yes, sir. Thank you all.
Good morning. My name is Nate Spearing. I work out at Dispatch Center, and I've met some of you out there in the last quarter, so I appreciate you coming out. Last year, we had 260,000 calls in and out of our dispatch center. Not all of those are emergency calls, but our incoming emergency calls total just about 75,000. Alarm line calls come into us as well now, so 6,334 of those. I would have put the text to 911 numbers up there. However, that's an entity-wide thing, so when it comes in, there's only 607 for the year that came into SHREC. And from there, it's impossible to say where they were delineated. So since it's such a small number, that's not on there. That 2023 and then quarter one for 2024. So every quarter I'm reviewing our stats to ensure we're NENA compliant, even though we are not required to be NENA compliant because we are a secondary answering point, not a primary one. We still strive for that. So NENA compliance standard, 95% of the calls answered in less than 20 seconds. We answer 97% of our calls under 10 seconds in 2023. Quarter one, it was 99%, and that shifted just a little bit there. Quarter one, we had all of our calls answered within 15 seconds. I attribute that quarter one versus 2023 increase to it's just a little bit slower when the weather is bad as far as calls go. So our average answer time is 4 seconds for calls, and we're spending about 3 minutes on calls when we get them. We saw that call count by month, again, what I was talking about, that's very consistent. May through August are definitely our busy months. And same thing with our time. So the time is in military time across the bottom. So 1400 is 2 o'clock p.m. 2 through about 8 is our really busy time. That's our peak time. That's also when there is 6 dispatch or call receivers on shift, and there's always 1 supervisor on shift to make up for that. So we constantly evaluate this to make sure we're spending the staffing wisely. Our staffing picks up at 10, which you can see it starts to pick up there, and then we rescind that back to 4 at 2 o'clock in the morning for that reason. I keep pushing the wrong button. In this right now, our staffing, we are down about 7 spots. We have a 66% training success average. I would love to take credit for that, but some of the first folks we hired were lateral entries and they had experience, so that's easy to ramp up. From that point, it's been entry level and it's been a little bit harder to retain those. We do have 1 person coming back in a temp seasonal position to help reduce the overtime that we're spending there. And then we also have light duty officers that are signed out there. So folks that get injured have an opportunity to work there. I'd had 3 light duty officers from January through the entire first quarter, and then I had 3 come back, so 6 total for March on. Just those 3 initially, we had 165 reports taken that officers did not have to respond to on the street, and we were able to get customer service right away to folks. So they're doing a heck of a job as well.
So on your training, are you like in a classroom training, or are you actually doing one-to-one training when you're bringing on new people?
Both. So we start with 2 weeks of classroom. That gets the policy and procedure, the way our department operates, and the functionality of CAD program up and running for them, make sure that they can hit the floor without any issues. Then our training goes to kind of an FTO process where they have somebody monitoring their phone call, able to step in if that phone call is going sideways or they're not up to what that caller needs. We do the same thing once they're signed off on call receiving, then they're able to fill that role by themselves. And then as we have availability for our trainers to accept them, we bring them in and we train them as dispatchers. And then they're back to working a radio channel with dispatcher monitoring, able to take over that call if needed. We don't have the ability to separate them off the floor and do either call receiving or dispatching in a separate training location. It's done real time, but it is monitored by somebody who is signed off for both of those. One of the benefits to that is they are cross-trained, so we have an expectation of our call receivers not just to take the call, even if they know maybe it's a civil issue and not going to warrant a police response, they're actually able to walk the person through that process and help resolve the call in that 2 minutes and 58 seconds, rather than put it back on the screen and force a sergeant in the field or a dispatcher to take care of that. Yes, sir.
Yeah, first off, thank you for your leadership in this position and all the work you've put in just to make this kind of continue to work and work as well as it does. I know there's been some conversation around perhaps rehousing dispatch, and I'm just wondering where that stands at this point and what your thoughts are.
My thoughts are that is not going to be an issue if and when it does happen. Recently, there was a wall put up in between police dispatch and the other entities in the building. That has actually been a blessing. It's not for any other reason than it allows us to hear each other very efficiently. The process doesn't change, whether you're separated by a wall in the same room or an entirely separate building. So where that discussion is, I can't answer that. I don't know.
Okay, thank you.
I just have one question for Chief. So Chief, you spoke about increased police service during Expo. Is that in the Expo budget, or is that coming out of the city budget for those increased officers?
So the officers, it's coming out of the city budget, but the way that we are, that we're adding staff downtown during the expo is going to be on-duty resources to limit the amount of overtime that we'll have to expend to cover that time. So we have some officers that will be completing their training that would normally be going and assigned to patrol teams that will be assigned to that downtown core. And then we have a few volunteers and other reassignments that will take place to make that happen. And what that will allow the downtown precinct to do is continue to answer calls for service in the core and do the activities they're doing now, and then field more foot and bike patrols during all these expo-related events when we have people visiting the city.
Thank you.
Questions? Yeah, thank you so much.
Thank you.
Yeah. All right, I'll have Chief Ober come out with the update from SFD.
Good morning, Council. You don't have mine up? Yeah.
Quickly, congratulations,
Yes.
Chief,
Yeah.
on being appointed to that
Yeah, I
position.
know.
Very well done.
There you go.
Thanks. Thank you.
Hot off the presses.
That's right.
Yeah, congratulations.
Thank you. Appreciate that. Looking forward to working with everybody. So, apologies if we don't have the PowerPoint up. So, I will do this through interpretive
Pull it up in the
dance
report.
then. So, we'll start with. If we can. But we'll start with overtime status. Let's start with some good news. So 2024, we are 24% lower than we were same time in 2023. So in 2023, at this point, we had spent 1.6 million, and we are at 1.2 of our budget. So That is great news. I do want to make sure to highlight, though, so we're in our FLSA pay periods now, so those pay periods tend to go up and down. So the first half of an FLSA pay period, you don't see a lot of overtime. It catches up at the end. This pay period 6 happens to be the first half of an FLS pay period. So we'll bump up, so that 24 is, I like saying that number, but it is a little bit deceiving. It'll self-correct a little bit on the next pay period. Moving on to the staffing report, we currently have the Deputy Chief of Operations, which was my vacated position, filled with an interim. Battalion Chief Darren Nywert is serving as our interim Deputy Chief of Operations. He started, I believe 3 weeks ago, hit the ground running, is doing some great stuff in operations, so real blessing to have him on board in that position. The Deputy Chief of Training position is still vacant, and the recruitment is live. We're anticipating having interviews hopefully by mid to late April. We have our senior analyst in our IT is filled, and she will start next Monday. So that's it's been vacant for just a little bit. That's going to be a great position to help with a lot of the strategic initiatives that we are working on. A lot of that is data collection, and so that position is really vital to make sure that we're getting that information out. Our 2024 Recruit Academy is on hold, but our current relief pool sits at 25. So the recommended break-even analysis shows that right now we need a relief pool of 44, but 25 is healthier than we've been in the 4 years I've been here, and clearly I think by our overtime numbers, we're sitting good. So even with that academy, that 2024 academy on hold at this time, I'm pretty comfortable with where we're at. We'll definitely see a little bit of an uptick come summer and the higher vacation and wildland season. In your packet, and I don't know, Jacoby, I think these are on that PDF. So we do have the overdose data for last month, and along with some heat maps. I don't know if you're able to bring that up at all. Okay. So we're working on this. I'll continue to report out on this monthly, but the goal is, after talking with Council Member Dillon, this will just become a normal part of your monthly packet, and if we need to expand on it during my monthly report, we will. But we've done a heat map that should be in your packet that's broken down by council district, so really not anything surprising there of where we're seeing the bulk of our issues. Yes, sir.
One more data point would be great for future versions of this is whether that the individual or where the location was. So was it exterior, interior? In other words, was the person housed, unhoused? I think that'd be really good information to have.
Okay. Yeah, and yeah, typically we will be able to pull that. Sometimes, depending on the way the call went down, it may be a little bit difficult to pull that as a data point. That's something that might just be in a narrative, and but we would definitely work on seeing what we can bring to that. The numbers, so we did have, it was a bad day to forget my glasses. Last month we had 80 overdose calls. The average age was just over 40 years old, about 70 to 30 as far as men to women is what we see in there. Let's see, if you can scroll down one, Jacoby, to that heat map. So obviously this shows that the downtown corridor is where we see a lot of our issues, and then it does flow out a little bit from there. So apologies for not having the slide show up. Moving on to the strategic initiatives that we're working on with the department. Obviously, our CARES and BRU expansion, working very hard with Maggie Yates and Ann Raven into really looking at what that will look like, how funding can help with that. So we're got lots of hands working on that. Working on the medication-assisted treatment that I spoke of last month. I will say to this date, we've not been able to utilize that. So we've come very close with a couple of patients, but since it is a study, there's some pretty strict rails on meeting the qualifications, and to date, we've just not had anybody that meets those qualifications. And speaking with Ann Raven, who's our medical manager, her and Dr. Edminster obviously are in conversations a lot, and it might be time to start having those conversations of do those qualifications need to be looked at to make sure that we are being able to bring people into that program. Station 5, we got the good news. We had $300,000 awarded to our $500,000. So we'll start to look at what that facility looks like as far as planning for that going forward. And then the nurse navigation program. This one, we are continuing to have conversations with Shrek on this. I was hoping to be able to report that we would be starting that in the very near future, still just running into a couple of snags. That's the program where if somebody calls in 911 and if it is pretty clear that it's not an emergent issue, we can send them to the nurse navigation line, which really helps connect them with a lower acuity need. So hopefully that'll continue to move forward, but it's not quite ready to roll out yet. And then finally, we did our 15th annual smoke alarm install blitz on Saturday, and we had a department record. So we went to over 500 homes with 362 installs, partnered with Fairchild, and we had 10 teams that were led by a Spokane Fire Department member. They were partnered with a Fairchild member. Obviously, lots of other thank yous, American Red Cross, Lowe's in North Spokane, got us those detectors at quite a reduced cost to be able to allow to do this. And then the Northeast Youth Center was our headquarters for the day. So a great rainy day. I think rainy days are actually a good day to do this because nobody's outside. They're all home, so they answer their doorbell. But any questions?
I was just curious, so you guys just knock on the door and ask if they want a new fire alarm?
So the week before, prevention goes out and puts door hangers on and lets them know that we'll be in the neighborhood the following week and what they can do. And then that day, it's divided up into those 10 sections, and each one of those 10 sections is literally goes door to door. And sometimes we have appointments from the week before where people say, yes, I do want you to come. And so we'll actually come in an appointment time. But other than that, it is knocking and walking.
Awesome. Thank you.
Two questions, and thank you so much for this presentation. And what do you attribute the decrease in overtime to?
Our relief pool is healthier than it has been in 4 years.
Okay. Yeah, thank you. And then on the overdose data, when you have the 68% transported, can you explain a little bit more about kind of that process and where folks are going? What does that kind of mean for intake and?
Yeah, and I'm going to bring Ann up here because Ann will be able to speak intelligently. And this is another data point that we're working with Ann's team on trying to really dig into those details a little bit more, because not being transported can mean a lot of things. It could be that they were given Narcan and they woke up and they walked away, and that is a no transport, basically almost a no patient. But Ann, you want to expand on?
Certainly. Hi, good morning. So if they are transported, what that means typically is that they have encountered emergency medical service personnel who have delivered Narcan. We typically deliver Narcan at a lower dose than the lay public or police officers, who are given a very standard dose, which is quite high. We keep them at a lower dose to keep them out of that severe withdrawal. The problem with having severe withdrawal is physically and psychologically extremely uncomfortable. And when they're in that space, even if they're delivered to the hospital, they want to feel better. And the most expedient way to feel better is to go out and to score more opioids so that they can get relief from that physical pain that they're in. So that keeps them somewhat sedated. We're bringing up their respiratory rate. Sometimes we bring them up to a level of consciousness, but we try to keep them comfortable. So we give incrementally small doses of naloxone. When a lay person or police officer, someone who has Narcan as it's been made widely available to everyone, which is wonderful and life-saving, they are often put into a severe withdrawal state. If they leave the scene prior to our arrival, unfortunately, that's a population that we're missing. When our BRU responds, and this is our hope, but we only have one BRU at the moment, but our hope moving forward, and as has happened, and they make contact with these people who are brought to a full state of withdrawal, a full state of consciousness, and are able to consent, we will consent them into a treatment program. And if they consent into a treatment program, we then ask if they'd like to be consented into giving Suboxone, which within about 15 minutes takes away that terrible withdrawal feeling. That way, they're more likely to continue on that path into a treatment program. And our behavioral mental health specialist, professional, gets them referred into a treatment program, and we will do a warm handoff to that treatment program. If the BRU encounters the patient and they want to go to the hospital, they can still go to the hospital, and our behavioral mental health professional still sets up a treatment program for them. So they're going to the ER to get evaluated because maybe they were without oxygen for a significant period of time as they stop breathing. But they will be, they will have a place to go upon leaving the hospital. And again, that warm handoff takes place from either a social worker or the mental health provider to a provider at the treatment center. Because that is one of the key things that we've found is that warm handoff is key, not just sending them to the ER, referring them out to treatment, hoping they get there. Yes,
Could
ma'am.
you speak to the capacity then of treatment center beds?
Yeah, that's where I was going.
I don't have any numbers on me at hand, but this is one of the things that my team has been working very hard with, and we actually do have quite a few beds available to us that are held for Frontier Behavioral Health, which is who our mental health provider is with, as well as for the fire department themselves. So we have detox beds at various places, Ideal Options, Stars, things like that, where they can get medication-assisted treatment or go through just actual detox without medical treatment, depending on what they want. And then we've actually worked with an agency, American Behavioral Health, for long-term placement. So now they've gone through detox. American Behavioral Health can come and actually pick them up in a supervised vehicle, take them to treatment. Some of these treatment centers are in Chehalis, are in Yakima, which we find to be helpful in that it's removing them from that community that they're in, which is supporting the substance use disorder and helping to place them in a place, and again, this is voluntary, placing them in a place away from that community that supports that behavior. So yeah, right now, we don't have an issue with beds.
All right. So no further questions. Thank you so much.
Sorry, I
Thank
have.
you.
Go ahead. Yeah, sorry.
Sorry.
Do we have any, as a fire department, are we allowed to, in any way on this medically assisted treatment, using substances like Vivitrol to help people to stay off of those for, 28 days or whatever it is?
I'm sorry, what was the substance?
It's Vivitrol is the name, and it's a shot, that helps people from getting those cravings and prevents the effects from, prevents them from being able to get high or get drunk.
No, so as of right now, we do not. We only have Suboxone, which works for about 24 to 36 hours. We can second dose them, which gets them a little bit farther. But in terms of the injectables, now those we do have access to in terms of the treatment centers that we work with can give them. But as an emergent crisis-based, we do not.
And how many of those treatment facilities do you know how many are licensed to use that?
I don't know, but I could find out for you, but I don't know, I'm sorry.
Yeah, wonderful.
Is that something that we could get licensed to use and utilize out on the street?
I believe anything is potentially possible. It would probably, much like Suboxone, we are the first in Washington State to be delivering this medication. So again, it would probably have to come in the form of a study, but I could talk to our medical director about that, sure.
Thank you. Yeah, great questions, great information. Appreciate it.
Thank you.
All right. Now we'll bring up Michelle Murray, although I don't see Michelle here for the SBO on grant research and writing. Oh, got Mr. Matt Boston.
Thank you. So this is sorry, I'm just pulling this one up. The apologize. I think this is for the SBO that we are pulling salary savings from the grants analyst position that we have within the grants department, the grants and accounting department right now, and pushing that into a grant research contract that we're going to be working with the mayor's office to be focused on bringing in a consultant on going after grants at the state level, at the federal level. We're ultimately the plan is to bring in our own grants department. Right now, we have it kind of parsed out within all of our different departments, similar to the higher ed model where there's a grant-specific department and there are individuals that are just consistently going after grants, and that is their job. That is our ultimate goal. Right now, we have a grant analyst. We're intending to have this consultant give us an idea of what are the grants that we could currently be going after, and then what is their evaluation of our current grants model as we see it.
Thank you so much. Questions? All right. Thank you. All right. Next up, we'll have Maggie Yates to discuss the SBO expansion of our CARES and High Utilizer Complex Care Initiative.
Good morning, council members. I'm here with the SBO to allocate a portion of our opioid settlement dollars. As you know, Spokane's projected, the city's projected to receive about $13.3 million in opioid settlement funds over the next 17 years. And this proposal would be, we currently have $2.2 million available right now, and we're looking to allocate $1 million total. $500,000 to support the expansion of the CARES unit in the Spokane Fire Department. You heard a little bit about that from Chief Oberg just a moment ago. CARES provides intensive case management to individuals after that emergency contact to make sure that folks are able to remain stable in the community after a crisis. And this funding would allow them to hire 3.5 additional FTEs to really expand their clinical capacity, to expand their case management, especially for the OUD population, which requires a significant amount of support. The second $500,000 would go to contract services for a high utilizer complex care initiative, similar to Hotspotters, which some of you might already be familiar with, which previously was hosted at a variety of sponsors, including SFD at one point. But Hotspotters is really intended to identify the high utilizer population of individuals who might be circulating between our criminal justice system, shelters, emergency room departments, and provide them with intensive case management support, and then coordinate care across providers, making sure that we're reducing barriers to care and improving stability and safety in the community. Happy to answer any questions if you have them.
All right.
Thank
There
you.
go. Thanks so much, Maggie. Okay. Next up, we'll have, got Mr. Piccolo. All right. We'll be discussing the resolution proposing property tax levy lid lift in 2025.
Yes, good afternoon. I'll be briefing this item. So the resolution in your packet is for the levy lid lift. It is scheduled for an August 6th election this fall, which means the deadline to file the council resolution with the county elections office is May 3rd, which potentially means your final action could come on April 29th, or prior council meeting before the May 3rd deadline. This is asking for a $1 per 1,000 assessed valuation property tax increase, which would generate approximately $37 million per year, starting in 2025. And this is a one-time increase, but a permanent increase, as opposed to, you might see like with the proposed park levy, which is a one-time increase for 20 years and then it goes away. This would be a permanent lift. The topic in the resolution is somewhat generic at this point, public safety operations. I anticipate that with the budget discussion on Thursday's budget meeting, this topic and the subcategories will be discussed and further developed before the resolution is finalized. And a question that came up earlier is this only needs a simple majority to pass. Do you have any questions? Yes.
Yeah, I'm just wondering, so is there conversation then from the administrative side around removing the parks levy from the ballot in August?
I believe those discussions will take place, probably starting on Thursday at the budget meeting.
Well, I just want to be clear. I don't support removing that from the ballot in August. In fact, there was a lot of consternation over removing it from the ballot in February already once before, and so I won't support doing that again. And that's going to really hammer my district with some really needed investments. So I think that's very unfortunate.
And just to clarify, if there is a effort to remove the park measure, because it's already been filed, the council will need to pass a resolution to rescind and withdraw, also filed by May 3rd. If we miss that May 3rd, it stays on the ballot unless you take some extraordinary action that I'm not aware of going to court.
Yeah. And the other piece, too, I would just bring up is my understanding is that they haven't decided yet, but there is conversation around the school district going back out again for their bond on that August ballot. And if that were the case, my sense is both of those go down. But it's hard to say what they're going to end up doing.
Go ahead.
So you were talking, language is pretty vague at this point, but is that something that will be more clearly defining as we move forward?
Yes, I believe so. This is really intended as a placeholder. So those conversations can be had to determine the scope of the title and the discussion of what activities will be covered under the levy lid lift.
And what's our timeline on this resolution coming forward? I know you said something about April, but what's our in our process? Where's that coming forward? When should we expect to vote on this?
Well, if the deadline to file is May 3rd and the last council action is April 29th, it would be in the next week or two.
It's filed for the 29th.
Okay, thank you.
So on that then, process-wise, are we, as council members, able then to bring amendments forward to amend that, to include different items? I'm just trying to understand, just because the levy is kind of, it's got to be specific to the language that goes on the ballot, et cetera, et cetera. And so how much room are we going to have to try to amend that?
Well, ultimately, this is a council action, so you have the final action.
Okay.
But I anticipate, again, that there'll be discussions between the administration and the council starting this Thursday at the budget meeting.
Yeah. Okay.
Quick turnaround. Here we go. Any other questions? All right. Thank you so
very
much.
much.
Appreciate it. All right. Next up, we'll have municipal court grant budget transfer. See Michelle.
Good afternoon, thank you. This is just a house cleaning item. We did the SBO when they accepted the grant back last year, and they put too much grant budget in the wages line, and we're required by SBO to bring it to you to remove it from the wages down to contractual services.
Any questions? All right. Thank you so much, Michelle. Appreciate it.
Thank you.
Okay, next up, we'll have the SBO for election services for ballot items.
Thank you. So this is SBO. We all know that, and I think I sent out an email to you all earlier this year that elections are very, very expensive. And so whenever we do have to go to a ballot, we do need to budget for that. Last year, we spent about $400,000 with the items that we had on the budget. We're expecting that it's probably going to be roughly the same amount. Again, we did have a February ballot that had Measure 1 and Measure 2 from the city of Spokane. We've also leaned on the library that they need to contribute on that. We're also going to talk to the council when we actually ultimately get that bill and see what our share is, because there were a couple of different ballot measures. But we're just anticipating that this is going to cost, so we want to have the SBO, the investment in the SBO as well as the actual ballot measure at the same time. So that's not a surprise to any of the council members.
Could you just share when you find out what the true cost is of that February ballot? Because my understanding is that our share is much less because of the school district and some of the other things that were on there. So
That is correct. It is. But the interesting thing is, just a couple of years ago, the cost went exponentially up because as a city, you have to pay for the postage of the residents that are within your city. So we have to pay for the postage, the return postage for all of the ballots to come back. It's very interesting.
Is that a change in state law?
Yeah.
Huh, okay.
Yeah, yeah, it happened a couple of years ago.
Mr.
Yes.
Boston, just, could you tell us where these funds will be pulled from?
These will be pulled from unallocated reserves. So the additional capacity that we had from prior year, yeah. But again, looking at it as an investment moving forward, that will turn us a substantial amount of revenue if it passes.
All right. Thank you so much, Matt. Appreciate it. All right. Next up, we're going to have a discussion on the Wildland Urban Interface Code adoption, my favorite acronym, WUI.
Thanks for having us. Some of you were on the council when we initially brought the Wildland Urban Interface Code a couple years ago and adopted it formally as a city. Dermot Murphy's here with me as the building code official, and I'm here as the fire code official. Just to state that this is a readoption of the 21 version instead of the 2018 version, and it gives us more flexibility than what the state has given us. So if we don't do anything, we have to fall under the state amended version of the 2021 code, which means that every structure that has to be built in the Wildland Urban Interface has to be built using the highest construction level of fire-resistant materials, which is a level 1. If we adopt the whole code and the appendices, as we've suggested, that gives our citizens the ability to look at defensible space, and depending on how much dispensable space they have around their home, they could build it at a lower level of ignition-resistant construction, thus possibly saving some cost. We both feel that it just gives our citizens the most bang for their buck if we manage the code that way instead of defaulting to what the state has adopted. Question? Thanks.
All right. Thank you so much. Appreciate it. Just ripping through today. So we'll go to Public Safety Committee standing reports and updates. We've not had the Municipal Criminal Justice Coordinating Subcommittee. We have had a public safety working group that Councilmember Cathcart and I have been on with the mayor's staff. We talked about bringing back hotspots, reviewing some data. Anything that you want to add to some of those discussions?
Yeah,
Recruitment.
Yeah, it's just been kind of general conversation at this point around how do we, improve some of those things, but talking about, I think, more like strategy around, folks who are ODing on the streets and who are the providers and what does that streamlined process look like, and there's just been a lot of conversation like that. But it's a great group. It includes the courts, it includes council, it includes some of our public safety, law enforcement folks. It's a good group.
Yeah. Hearing from the judges too last time was really interesting. And then our ad hoc committee on public safety levy, we did have our first meeting with Councilmember Bingle and Navarrete and I, talking a little bit about what could be in a levy, just an initial discussion around increased positions for police, fleet, behavioral health, municipal court, some things that we were considering investing in, as well as park rangers for our parks, park safety. Anything that you want to add to that?
Yeah, we had a quick discussion on, detention as well. Talked about, what it would look like as that money is ramping up, because we obviously can't hire, personnel overnight. And so taking those moments of, when we have revenue coming in, but we can't use it all on personnel. How do we maximize our capital in those moments until we get to a staffing level that we're comfortable with?
Yeah. Anything you want to add, Councilmember Navarrete? Nope. All right. And then, let's see, we got Police Advisory Committee. We didn't have our morning meeting last month, but there was a public meeting at the West Central Community Center. This does feel like a good time to remind folks about the upcoming community safety meetings. We'll want to hear more about the recruitment process for our new police chief and for the public to share their priorities. You can go to myspokanecity.org, Safer Spokane. Tomorrow night from 5:30 to 7, there'll be a meeting at the West Central Community Center. April 11th from 6 to 7 at the Northeast Community Center. And then finally, April 16th from 6 to 7:30 at the Liberty Park Library. For those that can't attend one of these meetings in their district, there will be a virtual meeting on April 30th from 5:30 to 7. But you can go to myspokanecity.org, Safer Spokane, to learn more. And then wrapping up, we have Councilmember Cathcart with Cops Board.
Well, we had a COPS meeting, but we're actually adjusting the time of those COPS meetings going forward, and so I wasn't able to make this last one. But I believe Candy actually stepped in for me. So I don't know, Candy, if there's any updates that you have, but. There is no updates. Okay, thank you.
All right. Well, that concludes our meeting today. Short and sweet. Thank you all so much.